Okay, this is the map of medicine. I've logged in, and so it's my name in here. We're in the international view, and here is the Google search button where you can search for anything. Now you can put in a specific pathway that you're looking for, or you can put in a search code. So for instance, I can put in protein urea and click search, and suddenly it's going through all the pathways, looking through all the nodes, looking for anything that's got protein urea in it. And as you can see, there are 42 pathways that have protein urea in them. I often use this during my consultations, looking for reasons why someone might have protein urea, for instance, hypertension, pregnancy, it's in bladder cancer suspected. And you can very quickly see what pathways there might be that you might want to think about, or conditions. And it's sort of like a differential diagnosis thing that you can just think about as you go through. So I find that very, very powerful as a way of identifying what sorts of things to think about. Type in vaginal bleeding as an example, and then suddenly it's starting to show me other things that I might want to think about and what sorts of things to consider. The other thing that's very, very powerful about the map of medicine, if we go back to the home button, is localized pathways. We're in the international view at the moment, but if you go into other views, then you can see all the different local health communities that have their own versions of the map. The one with the greatest number of local pathways is the Wirral. And if we go on to Wirral, then over here you can see the pathways in alphabetical order, but you can also see the ones that have been localized, or local information has been put into them. If we take an example of acute low back pain, then this is the local pathway that's been approved and developed by Wirral. And this is the back pain pathway that you can see here. And over here, severe nerve root symptoms not improving, consider the following: refer to specialist physiotherapy, spinal image, triage. And there's a little L button there showing that this is a localized node that's being created with local information. And if you click on that, you can see the local information. You can see how quick and easy it is to access this sort of information. It literally takes seconds, and that's why, particularly in the Wirral, clinicians are now using this as a very, very effective way of getting access to high quality information to help them deliver the best care possible. That's very quickly showing you local information and how the map presents it. We go back to the home page. You can also see things like medicine, cardiology, atrial fibrillation, what should I do? And it says atrial fibrillation, acute onset, non-acute, paroxysmal and persistent. And you've got a little information button that tells you more about it. So if you've got acute onset, and let's just have a look, you'll see how it changes from green to blue, indicating that this is the sort of thing that would happen in a hospital setting. History, examination findings, investigations that could be carried out. And a lot of these things, even though it's in blue, could be done in primary care as well, and indicating the reference on what's been used for it. We go back to the home page again. If I give an example of, let's say, rectal bleeding, that patient's come in with, and I click on the search button. Here it's giving me different I might want to think about. Let's go for colorectal cancer, even though that might be a possibility. Let's just go for diverticular disease, possibility. And it's just coming through. And I'll often use the map when I'm thinking about referring patients to secondary care. I'll see the patient, I'll look at the sorts of things to think about. So here it's symptomatic or asymptomatic. Look at considering differential diagnosis, and look how quick easy it is for me to think about other conditions managed according to presentation: diverticular disease, inflammatory symptoms or massive rectal bleed, manage symptoms, intractable symptoms, go to intractable symptoms, mild symptoms. Again, I can look at what mild symptoms are, what intractable is, click on intractable symptoms, and can go in there and have a look at intractable symptoms. And if not already performed, refer for barium enema and or colonoscopy. Abnormality found, and what sorts of abnormalities are we looking at? And at this point here it's saying consider referral to colorectal surgeon. Now what I could then do is, when I'm doing my referral letter, is explain that I've got diverticular disease, intractable symptoms, I've done a barium enema or colonoscopy, indicated what abnormality has been found, and then refer the patient as per the map of medicine. And it's a very powerful way of explaining why I've done what I've done and showing that I've implemented evidence-based care.